Hi, my name is McElroy and I'm a midwife and academic at James Cook University in Queensland, Australia. My research team includes Associate Professor Nicole Harvey, Dr. Kristen Wickham and Dr. Karen Yates. Today, I will share key findings from a recent study that we conducted to shed light on the challenges faced by rural and remote nurses who find themselves providing care to maternity patients in the absence of midwives. Whilst maternity education programmes such as the Imminent Birth Programme are aimed at helping to prepare RNs for this responsibility, there was no evidence that showed that RNs actually felt better prepared, physically and/or psychologically, to take on this responsibility. Therefore, a research study was developed to explore the perceptions and experiences of RNs in rural and remote settings who are providing care to pregnant women. We conducted semi-structured interviews with 8 nurses using hermeneutic phenomenological methodology that was guided by Van Manen's analytical approach. From the data, 3 main themes emerged. The first theme is entitled Being in the World of the Rural and Remote Nurse. What is meant by this is the uniqueness involved in living and working in a rural and remote location. Participants described rural and remote nursing as an entity with unchangeable aspects, such as the weather and geographical distances, as well as isolated working, and that these shouldn't be considered in isolation. The second theme is scope of practice, unprepared or underprepared. Despite the RN's extensive nursing skills, participants felt ill-equipped theoretically, practically, and mentally to care for pregnant women. Participants acknowledged the necessity of interdisciplinary practice, but expressed concerns about feeling underprepared for events such as childbirth. They felt compelled to work outside of their scope of practice to meet the needs of pregnant women, despite the misalignment between their knowledge and skills. While participants acknowledged the availability of maternity courses, they felt their educational needs were not being fully met due to difficulties with access and inappropriate modes of delivery. The final theme encapsulated the concept of how RNs felt morally distressed at times when they found themselves in a position of having to care for a pregnant woman, or even in the anticipation of having to do so. The participants described feelings of inadequacy and fear, and not knowing whether the care they were delivering was appropriate or not. Despite the moral distress that these participants felt, there was a sense of professional resignation and acceptance displayed during the interviews with me. The RN's strong sense of professionalism and duty of care towards pregnant women presenting for care propelled them to do the best they could, despite feeling uncomfortable working outside the scope of practice. This was a difficult situation for them to be placed in. Our study is the first to present a new perspective on rural and remote maternity services from the explicit voices of the nurses providing care in the absence of midwives. It reinforces the complexity of rural and remote nursing, highlighting the professional isolation and challenges posed by geographical distances. Looking ahead, the focus for the future provision of rural and remote maternity services needs to be equitable, appropriate, and woman-focused. However, it's essential to address the current challenges faced by nurses providing maternity care through research into education delivery and fit for purpose. In conclusion, the added stress of caring for pregnant women in rural and remote settings cannot be ignored, especially in the face of declining nursing recruitment to these areas. It is crucial to listen to the voices of the practitioners providing this care and work towards practical solutions that meet their needs and ensure the delivery of quality maternity services in all settings.